Welcome to the Sacred Window podcast. Here, we look closely at the intersections of the postpartum window, the Ayurvedic perspective on health and healing, and the universal mother principles that are the keys to giving and receiving effective care. Hello, I'm Christine Devlin Eck. I'll be taking you through interviews with professionals who are making a profound difference in the lives of their clients, conversations with individuals brave enough to share their stories of vulnerability as a way to lift up others, and my own journey through birth, parenting, caregiving, and building a conscious business. We are here to honor the sacred windows, the profound transitions in life that give it all meaning. Welcome to the conversation.
And I will never be the same again.
Hello, welcome. We're so happy to today on the Sacred Window podcast be welcoming Sujata Martin. Sujata is a pelvic health occupational therapist. She has a really beautiful approach because she's looking at the mind, body, soul approach of Ayurveda, which we, of course, know and love here. But she brings that into the Western medical approach, including osteopathic manipulation and, of course, occupational therapy to treat pelvic floor dysfunction. This is really, really important. We've talked a number of times in our programs about the pelvis. Sujata is really, we'll talk a lot about how you've integrated both East and West, but I also just want to say that you are also a clinical researcher. You're also the author of Not Just Kegels, The Exhausted Mama's Guide to Pregnancy and Postnatal Wellness, which I am excited to read. But you're also a mother, and I think what's most important here is that you have used this wisdom to prepare for your birth throughout your pregnancy. When I think about the different ways that I experienced changes in my own pelvic health during pregnancy, that was so surprising and really had no idea how to support myself. This is profound, but then also how that naturally leads into the postpartum window when we're thinking ahead, when we're kind of following the different stages of our pelvic health along the way, how that naturally impacts the balance and the healing process during the postpartum window, helping us avoid so many things. But we kind of connected with each other organically in the last few months, and it feels really special and aligned to have you come on and talk about this. So I'll stop talking and just welcome you very warmly and thank you for being here.
Oh, of course, Christine. Thank you so much for having me. It is truly a pleasure to speak with someone who understands like the beauty and wisdom of these traditions that have been passed on, through the centuries. You see the value in Ayurveda and all the how much healing it can bring to honestly every single person. It's such a um, it's a scientific and intuitive way of healing, which is why I love it so, so much. So you have no idea how happy it makes me to, speak with someone who recognizes that and doesn't just box Ayurveda in just like quotes, like wellness or woo-woo, or maybe it works.
Right.
So it's a true pleasure to be with people, to everyone listening and watching, and with you, Christine, for people who truly understand the impact it can have, both for the person who's healing as well as the healer. Like Ayurveda has changed my life, both as like a person, like my own personal healing journey, as well as my role as a practitioner. So the happiness is immense in being in this room.
Thank you, Sujata. Well, okay, we talked, let's just first of all state that as we talked about right before we hit record, Ayurveda is evidence-based. It
Yeah.
is time-tested. It is
Mhm.
not like
Yes.
a wellness. It is a medical,
Mhm.
it is the longest
Yes.
continually practiced medical science in the
Yes.
world. And
Mhm.
so this needs to be stated because
Yes.
as more and more physicians in the West start
Mhm.
to integrate
Mhm.
the principles of these
Mhm.
ancient sciences,
Mhm.
their work becomes better, the outcomes become
Yes.
better, everything
Mhm.
becomes more
Yes. Mhm.
complete. So, and this is what
100%.
you're doing. This is what you're doing.
Yes.
You're
Yes.
taking the best of these, two incredible schools of thought.
Mhm. Mhm.
You're combining it. So what brought you specifically to the pelvis?
So, great question. Honestly, in a nutshell, like my own mothering journey. So, I had been working in rehabilitation as an occupational therapist for close to 8 years when I was pregnant. And I was a first time mother in that very conventional medical system where the only guidance I received was go to your OB's office, every 4 weeks in the beginning. And to me, as a professional who helps people optimize their physical health, pre and post surgery through various medical health conditions, it did not sit right that I was expected to go through this massive physical change and then birth a baby through my pelvis. And I know, like, okay, a tampon fits in there, but like an 8 pound baby, like that was a very like mind-boggling a little. Like, I'm sure things are going to change. I want my body to heal well. What can I do? And that led me nowhere. So then there we deep dive into the internet. What options I have available led me to pelvic health. So I began my journey in just educating myself in doing certain movement practices, breathing practices, practicing in pregnancy how to be in certain laboring positions I envisioned myself to be, practicing pushing in those positions. And and that's the other thing, right? Like, I am a very logic based person. I am a medical professional, I'm a researcher, I love logic. And logically doing all those things, I had a very good birth experience. I had prepared for things, I knew how my body felt, I knew what I could do. I was able to advocate for my own self, in the birthing room, being saying I don't want to be on the bed, I want to walk, I want to breathe this way, all of those great things. But that's what got me to pelvic health, in that when I knew what to do, I had a good outcome, I had a positive experience. My birth did not leave me with baggage, which I'm sure you, Christine, and all the professionals listening, you hear it over and over, women have this disconnect from their womb space. They have sometimes, when the experience was so difficult, they have a tough time connecting with their baby, with their postpartum self. So how do we avoid that from happening? How do we again keep that sacred window healthy, safe, and not embedded with these memories that are hard? We teach women in pregnancy and pre-pregnancy how to connect with their bodies, how to take care of themselves, how to recognize the messages their body and their baby send them, you know, and act upon that. So that's what got me to pelvic health, that realizing that, hey, if I do those things, I had a good experience. If other women do those things, they can potentially have a good experience too. And yes, I'm sure this has come upon your radar also in the last like 5 to 7 years. Like pelvic floor and pelvic health, pelvic floor therapy has just exploded with social media, and women just talking more about it, getting access to these services, which is such a positive thing. And what I'm looking to tweak a little bit, change a little bit, is bring that wisdom of Ayurveda into how pelvic floor health is delivered, into how mixed into how women care for their pelvic floors, not just from that Western medical model. Let's do some Kegels, let's do some squats. What traditional practices, what time tested, what proven practices from Ayurveda can we bring into pelvic health to just heal better?
I love it. And I'm excited to get into those. And I also, yeah, I just want to say too that in other parts of the world, pelvic floor therapy in postpartum is
Yes.
the standard of care. This is something that
Yes.
everybody receives. It is
Yes.
covered by insurance. It is free. It is just
Mhm.
understood that
Yes.
paying attention to the pelvis after
Yes.
birth is necessary. And so we
Mm-hmm.
are a minority in
Yes.
the world of
Yes.
having that point of view as part of our postpartum experience.
Yes. It
And I
is so
also,
fun.
yeah, it's huge. It's huge. And that when I found that out, I was a bit mind blown. Uh, yeah.
Yeah, and truly though, because in my own practice, when I work with clients, I bring these two together, the Western and Eastern medicine approach, When I first see patients for their first pelvic health session, I am doing abdominal massage with Ayurvedic oils. I am
Mhm.
doing pelvic massage with the oils. I'm teaching them how to use a binder right. And this is all what you are sharing, right, Christine, through your work at Sacred Window. So again, I see that as pelvic health. That is pelvic floor therapy. While you may not be actually manipulating the muscles inside the pelvis, you are supporting the abdominal muscles to come back together to heal. You're helping those pelvic muscles that went through so much stretch to get some relief, from the soreness, from the stretching, to return to where they need to be. When they're in this weaker state, the binding is helping create stability, prevent that overloading of mom's lower back, her spine. So, in a way, the work you are doing is pelvic health, which is what, again, I want the world to recognize that this is pelvic health. This needs to be standard. So, also, we don't need to wait for like the 6 or 8 week mark to start teaching women how to care for their bodies. Doing this postpartum Ayurvedic care, starting at like 2 weeks, 3 weeks, even at that mark, I'm not sure the exact guidelines that you share, but that is a good, safe guideline that we share with our practitioners, that by 2 weeks or 3 weeks postpartum for a vaginal birth, you can, start doing this aftercare to support mom and to support mom's body. And also, when we do these practices, she's not going to carry as much water weight. Her muscles will be less sore. She's going to emotionally feel better. She is going to be more relaxed. Her milk will have more relaxin and those nice sleepy, hormones for baby to eat and sleep well. So really, we are supporting mom and baby health by using these techniques. So I very, very proudly do that in my pelvic floor practice, which is technically a Western medicine practice. We tell our clients that, hey, this is what you're going to get. And I'm telling you, moms love it. They're like, wow, that sounds amazing. To get like a womb massage on my first postpartum care session sounds incredible. Like, sign me up.
Absolutely. And it's just so good to recognize, as you've said, that whatever our scope of practice is, whether we're a doula, whether we're a licensed massage therapist, whether we're an
Mhm,
occupational therapist, whether we're
mhm,
licensed to, practice internally or only external touch, or neither,
mhm.
we can support people with pelvic healing and health
Mhm,
regardless. It's like you can approach it from so many different practices and tools and skill sets. Um,
mhm,
and that's profound. That's
mhm.
profound because people, professionals are drawn to support new families, new moms in particular,
Yes. Mhm,
new birthing people with
mhm,
whatever skills they can because it's so
mhm,
needed because it's left out of the
mhm,
street for health. So that is huge. And I also, I love that you not only have a busy client practice, but you've also opened up the door for professionals serving in all kinds of, licensures or certifications
mhm,
to
mhm,
be able to understand the pelvis more and what they can do with clients to support them. But I want to like get a little like nerdy about like what are the things that specifically we can do with
mhm,
bringing Ayurvedic wisdom into specific health. And you've like mentioned a few of them, which I'm
mhm,
just imagining in my head to be so
mhm.
lovely. But
Yes.
what are a few things that you
Mhm,
really have learned from your experience, your, lifestyle of living Ayurveda
mhm,
that you've brought into this Western medical space and pelvic
mhm.
health?
Definitely. So, some of the things I treat, even outside that perinatal window, often digestive dysfunctions, chronic constipation, IBS, diarrhea, or even just bloating with certain foods, where someone doesn't have a diagnosis, but they have a clear digestive concern. The basic, like, this practice of the navel oiling, so
Yes.
using dripping oil through the navel. And if I don't know someone, like, and that's the other distinction I make, I am not a Ayurvedic physician. If someone needs that level of diagnostic care, I am referring them out to a Ayurvedic physician. I am an Ayurvedic practitioner. I have a general overview of understanding, okay, what is this person's body? What is their imbalance? How do they need to eat? What do they need to change? What kind of self-care do they need to do? So the oil that you use will depend on that, right? Because that's the thing with Ayurveda, it is not cookie cutter. So to those listening, you would have to pick the oil like sensibly. But if you were not sure, if you are again someone like me who cannot like accurately diagnose, just stick with something warming like sesame mustard, pick an oil, dripping it through the navel. And I teach people this very gentle self massage. And we can do it even now on this format, even for those listening. All you have to do is you use two fingers, like the index finger and your middle finger of your dominant hand, that will rest in the navel. And recognizing, right, in Ayurveda, we work with the body. We are not pushing into the body. We are not like coming at it. We are instead like working with it. So resting at the navel and gently sinking in. So this is from the Western medical lens, we are doing an internal fascial massage. From the Eastern medicine practice, this is navel oiling and an abdominal massage. With my other hand, with your other hand, you will support the dominant hand. We are going to visualize the navel being the center of a wheel. So it has spokes that run from the bottom of your breastbone or sternum to your pubic bone. You imagine a spoke going right across, and then the diagonal spokes, connecting one rib, the bottom of the rib cage, to the opposite hip, and the same way on the other side. And now with those two fingers in the navel and with your supporting hand, you will just sink in to your abdomen and gently apply pressure, maybe just downwards from the navel straight down to your pubic bone. And you will hold that for a few breaths. So this is the other thing, right? We want to work with all levels of this individual self. This is how we train people through the Integrative Somatic Healing Institute. So I'm not just doing to the body, I am engaging the client in their own care. So I would have coached my client, you're going to close your eyes, you're going to relax into the table, and now take a gentle inhale as you feel me gently moving your tissue downwards towards your pubic bone. And the thing is that ease that the breath will bring to the tissue helps us in not using much force. And that's why we are again not moving into the system. The system is moving with us. As they exhale, we relax, come up, back to the navel. With the next breath, as they inhale, we can do an upward motion towards the sternum or breastbone, so away from the pubic bone, and hold that for a few seconds. And let their breath go, and then come descend. Also, again, coaching and the right breath, right? We don't want that big upper chest breath, making it, I give my clients the analogy of like the Tai Chi flow, how when someone, because Tai Chi is like, they are working with Chi, with energy. So just like we want energy to move easily, when we are doing this work with like yoga-based breath work and this work we are doing with the body work, we want the breath to move easily. So allowing the breath to come nice and easy, not breath holding, and then moving with that massage as we move along those spokes of the wheel, of the abdomen, using that belly button as the central point of control, and your supporting hand just gently guiding the tissue along in the direction of pull. So that is a very, very wonderful strategy, helps people with digestive issues. In addition to the oil in the navel, I also just recommend rubbing the oil all over the abdomen just to soak all that wonderful, healing power in. Depending on, again, the person, sometimes I will use a medicated oil. For women, I often like using like Dhanvantaram Tailam, which has a lot of supporting herbs. So for postpartum as well, for women trying to conceive. So we can always modify as the person's system needs. But that is a very easy practice. The other easy practice would just be, so many of the clients we see here in the West, when they think, oh, I'm taking care of my health, they want to eat clean or they want to do more plant-based food. And that leads to people eating raw, cold foods so often. And what people don't recognize is that if your digestive powers are off, like your digestive system is off, either you are constipated or experiencing diarrhea, your digestive fire, your Agni is weak, or it is off, like it's too much Agni. We need to like calm that down. So adding in nutrition in the form of food that is hard to process is just bogging your system down more. So the messaging you share with your postpartum practitioners about the cooked foods, the warm foods, incorporating that for people at any age who are having digestive issues, that is something I use so often. So, yeah, those are two big things. The other thing I really love sharing, and a little off topic, in my work, oftentimes I will have folks who are experiencing mental health challenges. Because honestly, if you are having a difficult time with postpartum healing, or you have chronic pain issues in your pelvis or your abdomen, which is what we see a lot as pelvic floor therapists, you will very likely have depression, you may have anxiety. People come to us with pre-existing mental health conditions, and oftentimes what happens, especially with the newer changes, like if the postpartum period brought about the anxiety or the depression, I do not like for folks to make the diagnosis their identity. you know like,
Mm.
I am anxious, I am depressed. That's what the Western medicine model tells you, like, oh, you are anxious, you have PTSD, you have this. Whereas Ayurveda will tell you you're experiencing your dosha is imbalanced right now. So telling
Mm.
them that this is a temporary imbalance in your health. You had a difficult birth experience. You experiencing anxiety, is my baby sleeping at night, and checking on baby multiple times, that is not a completely rational response to your baby having difficulty breathing when they were born you know so you are not being irrational, you are not being dysfunctional in your mind is prompting you in a logical way to what you experienced and that memory that has stayed with you, right? And also, this is temporary. With healing, with health, your balance will shift. With supporting your body, building up those foundations of nutrition in postpartum, good body care, good support, even in the sense of like honoring rest and not jumping into like a snapback, you know, that will help your hormones realign and you not feeling so anxious, so depressed in the postpartum. So that is a big piece I like to try and share with clients and with professionals. So that I love about Ayurveda, how you are not your illness, you are experiencing an imbalance. So let's figure that imbalance out and let's support your system, like your internal system, with what it needs. And the illness or dysfunction fixes itself. And you are your good, healthy, balanced self again.
How are you sharing your gifts and passion for caregiving with others? In a world where education and awareness around the postpartum window is lacking or missing from our modern systems, we have a profound opportunity to shift that paradigm. You may be a few simple offerings away from making a truly impactful difference in the lives of mothers and families in your community. We are here to support your journey in the ways that work best for you. Schedule a conscious care strategy session to meet one on one with me, and let's identify the right next step for you to begin a path of conscious care for new families that fits your life and your needs. Visit www.sacredwindowstudies.com/strategy-session to schedule a time that works best for you. That's www.sacredwindowstudies.com/strategy-session.
Imagine, yeah, that's so powerful. Like, imagine if all of our care professionals were coming with that messaging, and we can shift away. Yeah, we do that unconsciously, identify
Yes.
with
Mm-hmm.
our diagnosis.
Mm-hmm. Mm-hmm.
All it's really profound. And what does that do to our body and
Yes.
our identity? It's,
Mm-hmm.
the mind and how we identify ourselves runs really deep.
Yes.
This
Yes.
this is really beautiful, and I would love to actually talk a little more about the mind and the emotions and how those are sort of almost held in the pelvis. The pelvis is like this bowl that, like,
Yes.
we just don't often realize how impactful the
Mm-hmm.
way that it's situated, or like how it is supporting our whole body, and how that impacts how we feel, how we
Mm-hmm.
behave, how we think.
Mm-hmm.
So
Yeah.
I would just love to invite you to talk a little bit more about how you see that in your
Mhm.
work, and
Yes.
what are some of the impacts that approaching pelvic health like directly impacts someone's mental health and emotional health?
Yes. Christine, I missed the last piece of your question, the last question you shared. Could you please repeat that?
Yeah, I would love for you to just share a little bit about what you've seen in your practice in regards to how working with the pelvis
Mhm.
directly impacts somebody's
Yes.
emotional and mental well-being.
Oh, definitely. So, again, I find it so funny, honestly, so as a Western medicine practitioner, I try and keep up with research. So I'm reading research papers, I'm looking at what the latest, the researchers are putting out. And it is so like I have an inside chuckle when these studies like prove what Ayurvedic practitioners, yoga scholars have been saying for centuries. Meaning, talking about how when someone has so the concept of nadis and prana needing to move through nadis well for that area to be healthy, that was the like turning point when I realized like wow, there is so much application to the yogic way of looking at energy and teaching people energetic control. That was like kind of the turning point in my pelvic health practice. Because as someone who practices yoga, I do a lot of pranayam. I'm not a very big asana practitioner, but I'm more pranayam, meditation. I do a lot of mindfulness, more jnana yoga, bhakti yoga. So that is my background. And then bringing that into my work, I found that people who would have like pain conditions, whether that is pelvic pain, like from painful periods, PCOS, endometriosis, or people who have fertility challenges, like, difficulty conceiving, miscarriages, infant loss, people who have experienced traumas, whether that is sexual, it could be emotional, it could just be shaming about their body, their sexual identity. They would always present with tightness in their pelvic muscles, right? When I would try and guide them through a pranayam, they would have a very tough time bringing their breath and conscious awareness down lower than their belly button. A lot of folks, depending on the extent of other things happening, whether they were experiencing anxiety, GI issues, their breath, their conscious awareness would stop at the rib cage. So and in the Western field, we call it like guided meditation or guided muscle relaxation. Like that's a technique psychotherapists use often to bring people into states of feeling more grounded. And then seeing that parallel of when someone has that experience of sexual trauma or loss or pain in the pelvis, their breath will not go beyond the rib cage, will not go beyond the navel. And that lines up so well with that concept of the nadi being affected, being challenged, being blocked. I would not say truly blocked, but just having challenge in accessing that part of that body consciously, energetically. So that is what I would find like so wonderful in that the recognition that if someone has dysfunction, their nadis are not going to be as active as, accessible to this individual. Their energetic centers, their chakras are going to be not as, vital. They will have a tougher time accessing it. And then beautifully also when we teach this individual experiencing these states to access them through very safe, informed touch, because that's the other thing, right? We do not push into trauma. We come from a very informed, consent based place, both from the Western medicine lens of like psychotherapy and staying in safety, and also from the Ayurvedic principle of working with the body. I don't want to throw a system that is already in, imbalance into further imbalance. I want to stay in comfort, stay in safety. So, as a body work practitioner, because that is what I am, despite all the medical licenses, is I will have my touch on between their navel and their pubic bone, and I will just have them bring their breath in with that relaxation of the face, relaxation of their eyes. Have them visualize like a color going down that central, that sushma Sushumna Nadi. So very simple pranayam practices we can weave into our work, whether you are a massage therapist, a pelvic health occupational therapist, physical therapist, chiropractor. And the wonderful thing is that there was a time when I did the touch and my manipulations without this knowledge, without the knowledge of the nadis, prana, bringing conscious awareness down. And it would take so much longer for my client to get to my goal of being aware, having less tension, because they were in these protection patterns. That's what the body does. The body is so wise. It knows, like, I have been hurt in this place, I have pain here, I'm going to create muscle protection and I'm going to create fascial tension in this place. So it's a protective mechanism. So when I would do my work in the past, before I began adding in this knowledge of yoga and Ayurveda, I would get to my outcome, but in a very long, drawn out fashion. Whereas now, I am getting there quicker because the client is participating, because their body is accepting and welcoming that touch. And more so, I am not the doer, the client is the doer. I think that has been the biggest learning lesson, because that used to happen to me, like, oh wow, I did this with a patient, I did this with a client, I made them better. But then no, I think I am a better practitioner now that I realize that I am just the guide. This body is healing itself. I am just like showing them what to do, you know and that helps them take ownership, and that helps them be a partner in their care. And again, imagine that mom, and then we use affirming language like that, because I will hear clients say, oh my gosh, that felt so wonderful, thank you so much. Assuring her that you did that with me, it is because you were able to breathe into that tissue that we were able to get that release. I would not have been able to if you were not able to bring your breath in, if you were not able to consciously relax that muscle. Otherwise, I would be struggling to achieve release, because I'm not that practitioner who's going to push in. Like, we have all heard of those. We've all had those incidents where we go for a massage or any kind of body work and we come back feeling like sore, or I know some people like the good pain, but honestly, to the body, there is no good pain. Pain is a message that something is off, because then folks who like the good pain inevitably end up needing more care soon after. But I'm digressing. Anyhow, so that's what I see in my practice when combining these two, is that my clients get better quicker, and most importantly, they begin achieving more confidence in healing themselves. They are no longer stuck in that place of like, I am sick, I am a patient, I need professionals to fix me. They learn these practices in our care interactions of how they can do this themselves. And there is nothing better than that, right? In us empowering our, and not empowering our clients, like they already have the power. That's another thing I really try not to use. And I hate to say I empower people. I'm like, you are powerful. I am just helping you tap back into that. Like, you were dissociated from your power because of the messaging you received, because of certain events that might have happened. We're just bringing you back there. That's all we are doing.
I love that so much. It's such a difference between Ayurveda and the Western medical system, is that we have this tendency to feel like we need somebody to fix us. We need somebody to
Mhm.
do, and
Yes.
100% there are people
Mhm.
who, doctors who have skills that we cannot have
Oh,
ourselves, don't
certainly.
have.
Yes,
And
certainly.
there is such a difference in the outcome of how we heal when we
Mhm.
recognize that
Mhm.
we have so much within us to
Yes.
participate in that, not only to participate it, but actually to direct it. I
Mhm.
think that
Mhm.
too, with, the best thing we could possibly do as doulas or anybody present, particularly during the postpartum window, is help
Mhm.
the person recognize
Mhm.
that they know themselves best, that they know their
Mhm.
baby best. And yeah, just the difference you see in
Mhm.
the entire experience.
Mhm.
But I do want to just fill in for those of you who don't have an Ayurvedic background, the nadi system is this energetic channel system. And so when Sujata's speaking of the nadis, these are the channels where we're able to bring and I remember so vividly being in Ayurveda school, and one of my very favorite teachers, Claudia Welch, had done a meditation meditation with us on bringing our prana through our breath. Pranayama is the direction of our breath, our life force energy, bringing that prana down to our pelvis and into, really just kind of almost looking around with our prana,
Yes.
and like just letting it sort of occupy and like looking for any space within our pelvis that
Mhm.
felt any
Yes.
kind of tightness or difference
Mhm.
that we
Mhm.
wanted to
Mhm.
shift.
Yes.
And the lesson is that anywhere we direct our prana,
Mhm.
that's anywhere we direct our attention, that's where prana goes.
Yes.
Anywhere we bring that prana, there's a balancing that begins to happen. There's
Mhm.
energetic shifting that starts to happen.
Mhm.
And
Mhm.
so this particular meditation happened after we'd eaten a big meal. And so it was really about trying to help
Yes.
direct some digestive
Mhm. Mhm.
to increase our agni or to balance our
Mhm.
agni. And
Mhm.
it was so
Mhm.
powerful. So I
Mhm.
loved kind of revisiting that as I was listening to
Mhm.
you.
Mhm.
But the fact of the matter is that when we bring in the
Mhm.
concepts of
Mhm.
our energetic
Mhm.
body
Mhm.
into the physical healing process,
Mhm.
there's a dramatic change.
Oh, certainly. And if you look to like Western research, it supports it. Like for so many conditions, like for pelvic pain, one of the very um, research proven interventions is called biofeedback, where I don't love it because it includes the placement of electrodes in the pelvic region, and the machine tells the person when they're relaxing, when they are contracting. But we can do that with our hands. We can teach the client to do that with their hands. Can you feel your breath coming down? Can you feel the relaxation? So, and even like, for example, like you said, Christine, we need our doctors, we need the skilled surgeons. Yes, even with big cancer centers like Mayo Clinic, they now have like Reiki practitioners on hand. Typically have like better stress management, mindfulness practices. They're doing so. The very conventional Western medical model is recognizing the positive outcomes from mindful connection a patient, a client can have with their own self. And that is what I'm looking to bring into pelvic health.
Mm. I love it so much. I really appreciate this. And I think that as in all, yeah, I loved imagining you sort of finding such joyful satisfaction when you read these studies and
Yes.
you're like, oh, ha 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 ha.
Yes, we know that. Yes.
It's
Yeah.
beautiful. It's beautiful. And it gives me so much hope
Mm-hmm.
that more and more
Yes.
Western medical practitioners and Eastern
Yes.
medical practitioners
Yes.
find this,
Mm-hmm.
you know, this connection and in the ways
Mm-hmm.
that we overlap and how much
Yes.
richer and how much better it
Yes.
is for patient
Mm-hmm.
outcomes and
Mm-hmm.
people in general. And I also want to acknowledge how you mentioned early on in our conversation about how it's not just about the people we care for, it's about ourselves. And when
Mm-hmm.
we have this recognition that we're in this together, like we're on this human journey together, and as I care for
Mm-hmm.
you, I care for myself and you care for me,
Yes.
and that to me is the most beautiful part, really.
Mm-hmm. Yes. Oh, yes,
Yeah.
definitely. Thank you so much, Christine.
Yeah, so I just, for those of you listening, please, in our show notes, we're going to have links to Sujata's, both her pelvic soul practice, but also the Integrative Somatic Healing Institute, where she's teaching doulas, she's teaching chiropractors, she's teaching massage therapists, all kinds of professionals who are really looking to know more about how they can support pelvic health with this really embodied approach of bringing in
Mm-hmm.
Ayurveda.
Yeah.
And yeah, is there anything you want to leave us with, Sujata, that we didn't get to add, or something you might want to say in closing?
Yeah, just that, we don't recognize how much impact Ayurveda and Ayurvedic based practices can have through the lifespan for someone, that we think we are treating a pregnant person, a postpartum person, but we are setting her up for like years of healing and years of being like her experience of that self, her connection with our baby, and how well she bonds with that baby. We are changing like family systems, like the work we do is so vital, right? And also that out the same practices translate so well to someone who's trying to conceive. So many of my current patients, especially like since COVID happened, our bodies, so many of our bodies have changed significantly. I experienced it myself that I no trouble conceiving my first child, but Ayurveda and Chinese medicine is what brought my second baby in, of good body work, the herbs, all the practices. Like this work goes beyond wellness, goes beyond postpartum care. It can help heal real dysfunction. Like I had seen two IVF clinics, like very well rated, great doctors, all of that. And I struggled, and finally, what brought, and you met my baby earlier, Christine. What brought him into this world is Ayurveda. So if not for Ayurveda, like I would not be a mother of two children. And like what a gift that has given me, right? So we can bring healing not just to like our clients, but it changes our lives. It has impact into in our own little bubbles, in our own life journeys, life stories. And that these practices can be applied like through the lifespan. We treat so many men. Men have pain, men have digestive issues. These techniques can so easily be applied to those people. Once we gain expertise in working with the abdomen, with the pelvis, like traditional Ayurveda, there is so much like massage for the whole body, body work, relief for like chronic joint concerns. This work is just like so rich and so widely applicable. That is what I'm hoping people recognize.
Well, I'm so happy to participate in
Mhm.
sharing this conversation and to help spread just the awareness that it's so much
Mhm.
more than just
Yes.
a
Yes.
pelvis. Uh,
Yes.
and thank you. Thank you, Sujata, for spending this time with me and for all of you listening. I hope that that tonight you go home and you practice that belly massage because that's what I'm going to do tonight.
Yes. Yes.
I love it. I can't wait.
Mhm.
And thank you so much again.
Oh, you're
I
so welcome,
appreciate your work.
Christine. Thank you. Thank you so much. And thank you to everyone listening.
Shanti, Shanti.
The Center for Sacred Window Studies has been training postpartum care providers, professionals who work with new families, and individuals passionate about postpartum care since 2018. We regularly host live free events alongside our online and in-person training and certification programs. Hop on our newsletter list to get direct access to all of our events and community support gatherings. Our mission is not only in training conscious postpartum care providers, but in fostering a robust, informed, and thriving community of postpartum professionals. Once you step inside, you're family forever. Visit www.sacredwindowstudies.com to add your email to our newsletter list. You can support our work by subscribing to the Sacred Window podcast and sharing with someone you know who would love it. Thanks for being here and participating in the culture-wide shift that recognizes the need for and the importance of conscious postpartum care.